it's your girl, Miss Tony, and this is week 28 of my 40-year-old pregnancy journey. Glad to have you back. If you have not subscribed yet, please do. I would love to have you in my camp and following my journey, whether you're a new mom or you are planning to be a mom or you're just interested in this type of material. You might have had your kids a while ago and you just like going down memory lane with me. So I appreciate you no matter who you are. Thanks for joining. So this week I told you guys was my 28-week appointment, my ultrasound, and it was amazing. Again, I love going to these appointments. The one thing that has been hard though is that Kelvin hasn't been able to come with me because of COVID. And he literally didn't miss a single appointment with my first and my second daughters. And so I kept telling the doctor, I wish I could like FaceTime him, and they just have this strict policy with cell phones. And so they wouldn't let me do that. But I was like, okay, he would love to be here. He would love to see this. He would love to experience this. And so I did do a quick little video, even though I wasn't supposed to. And here it is. Here again at my doctor's office, my second home. No, I think my lab is my second home and the doctor's office is my third. But just here for my 28-week follow-up appointment. Here we go. I'm here at my maternal fetal medicine doctor and I'll get my ultrasound this time. Can't wait. Guys, look at the baby. Super cool technology. 4D. So you see face, foot, arm and hand. So he just printed out a bunch of ultrasound pics for me so I can have some for Kelvin. And they came out really nicely. Beautiful. Thinking the baby might look like my second baby, Cammy. I don't know. So yes, y'all, did y'all see that face? Oh my gosh. So yeah, I really do think that the baby looks like my second, Cameron. And Kelvin swears, just looking at the ultrasound pics, that he can tell it's a boy. I'm like, dude, you can't tell nothing. But it's wishful thinking, you know, whatever he thinks from looking at the baby's face. I said, dude, I could show you a finger on the sonogram. You would have been like, yep, that's my boy's finger. I swear. But yes, I was able to get the extra so that he could have them and I could have one. And look at these baby's toes. I know there's a glare, but look at the baby's toes. Oh, I love that. And the rest of them, as you guys saw, the baby is what I thought. Remember last week I was saying I felt like the baby was just up here, like not covering the whole belly area, but just at the top. And the doctor confirmed that. He said the baby was facing him again, but the head was here and the baby's bottom was down here, but the baby's feet were up here. And you guys could see on the scan, the baby's hands were up here too. So the hands and feet were right next to each other. Head was over here and the bottom was all the way at the bottom, but I could still feel the movements in the bottom. So I was like, well, what is that feeling? Even like literally during the appointment, I could see the baby on the screen in that position, but I could feel movement in the bottom of my uterus. And so the doctor was like, yeah, it's any reflex. Like it could be the baby's bottom. Like it could literally be any part of the baby's body. Or if one hand is up here, the feet are up here, but one hand is down there. He was like, you never know. So it's just so interesting, you know, seeing the baby and then feeling movements simultaneously and just trying to understand like what's going on in there. It was super cool. So interestingly, what he also shared with me was the measurements. And this is kind of funny. So, you know, he's got all this technology. He's got his computer over here. He's got the screen up here and he's like swiping pages. And I saw a big number. I saw like an 80%. And so I asked him, I was like, well, what is that number representing? And he swiped back real quick, like, so I wouldn't see it anymore. And I was like, doctor, I already saw it. Like, what's up? And he was like, well, I don't mind telling you, it's just that moms freak out if they see high numbers or low numbers. He said your baby is right in the center. He had showed me the graph, and he showed me the center of the graph, and the baby was growing along the center. He had showed me the point from my previous appointment, and then he showed me the point from this appointment, and the baby was growing exponentially, but at the rate that it was supposed to be growing at. And so he said, so 80, that is your percentile for your baby's head. I told y'all. I told y'all my baby's got big heads. And so, yeah, this one is no exception. Apparently, the baby's head is measuring like 2.5 weeks further along than the rest of the baby size. But also, interestingly, he said the baby's only in the 40th percentile, which again is in the normal range. So if you're like, 40 to 60, they consider that normal. They consider that within the 50th percentile. And so he said, so the baby's size, like minus the head, is in the normal range. But he said you are still measuring 4 days earlier than the date that we already changed it to. So I'm like, y'all are not changing my date again. I can't, like, y'all can't just keep changing it. That's not normal. Like, no. Like my doctor's appointment 2 weeks ago, my doctor told me like the baby was average. Like there was no slowing down, and I assumed there was no speeding up either. And so I was surprised when the doctor showed me that screen, which showed a due date that was like 4 or 5 days sooner. And so I'm due, or they have changed my date twice, but now they're saying I'm due July 9th. This is showing for, I think it was 4 or 5 days sooner than that. So I'm like, okay, this maybe is going to be a 4th of July baby. Who knows? I was trying to have this baby close to my best friend Mary's birthday. She's gonna be the godmom. And I was trying, she's July 13th, but we keep getting further and further away from that date. And at some point they're gonna try to give me a June baby. I swear, this baby's gonna try to come in June. But who knows? I will be off work at that point, so I'll be ready. So remember I told you guys I did inform my direct manager about my pregnancy maybe a month ago, and now I've started the process through HR. And so at this point, I think I'm going to go out probably mid-June. My first and second babies, I went out the whole 30 days prior to, because I mentioned to you guys in a previous video, California is very generous with their maternity leave policies, and they give you 30 days of maternity disability. And so I've taken full advantage on the first 2 babies. But I think for this one, I'm probably going to work up until about 2 or 3 weeks prior to my due date. And so I got to be careful though, with this dates keep continuously changing. Got to be careful. So the one new symptom that I'm experiencing now is not a fun one. I guess most of them are not. Like, are any pregnancy symptoms fun? This one is cervical pressure in my uterus, my lower uterus. And so I didn't know if this was what I had heard of from my sister-in-law. Shout out to Nikki watching. She had told me, I think I can't remember if it's her first or second baby, but she had told me that she experienced something called lightning crash. I'm sorry if I'm putting you out there, sis, but it's a common symptom with pregnancy. And I was thinking that that's what this was, but it wasn't like a shockwave of pain that kind of came and went. Sometimes I've been told that can get you to have you weak to your knees because it's like that painful in the moment and then it goes away. This hasn't been like that. This is more like pressure that just doesn't go away. Like it's just there. And I'd be telling Calvin, my vajayjay hurts, and he like, what is going on? So it sounds funny, but it's not actually my vajayjay. Like it's not that low, the pressure, but it just feels like my uterus is heavy. That's what it feels like. And so I mentioned that to my doctor, and he said it's pretty normal once you hit that 3rd trimester, and especially if it's not your first child. And so I thought that was interesting, because I would have thought you would have felt that in your first baby. Your body's getting used to the weight and everything. But he said, nope, it doesn't typically happen in your first pregnancy. It happens in latter pregnancies. And this is my 3rd. And so he said, the best thing to do is to get as much rest as possible. And I may have to invest in what I was telling you guys about in one of my previous videos, a new belly belt. You guys know I have the underwear that I can just pull up over my belly, which is very comfortable. But I tried that and it really didn't feel like it was taking any pressure off. It helped when I had that muscle spasm. It did really help then. But this pain doesn't, my muscle spasm was here and this pain is like lower abdomen. And so I'm looking for recommendations if any of you have experienced any cervical pressure in late pregnancy and you use different belly bands, or I've seen some like vaginal support underwear, or some support that covers like your vajayjay, but it also covers some of your belly too. So anything like that, I've seen them online, but there's so many and it's so hard to choose from. So if you guys have any recommendations, I would love to hear from you. Write it in the comments, send me a message. I've noticed that it's mostly when I'm like sitting for too long that I start to feel it. The other times are like when I'm eating dinner and I'm sitting while I'm eating my dinner, and then I continue sitting for like, let's say I'm watching a movie with Kelvin or something, and I'll stay seated for like another half hour. I think just the combination of me eating and being seated is another trigger for me. And so I'm going to start to watch for that. And after I eat immediately, I'm going to get up and just walk around. You know, we have a couple stairwells in our house, so just go up and down the stairs. I got my treadmill in the garage, so that's something I typically don't do right after I eat dinner. But I think if I go slow, that'll actually help me more than it'll hurt me. So it's something I'm going to try just to see if I can get some relief. Oh, the joys of mommyhood and pregnancy. So the baby is measuring about the size of a head of lettuce. Last week it was cabbage and this week it's lettuce. That's about 15 inches and supposed to be like around 2 pounds, 4 ounces. After my appointment, the doctor told me that the baby is measuring closer to 2 pounds, 13 ounces. So this baby is almost 3 pounds already, which again is part of the reason why he mentioned the data shows the baby's 4 or 5 days bigger than the expectation. So I don't know. It's kind of funny because I don't feel different. This whole pregnancy actually feels like my first two, and I have 2 girls. And so people are like, well, you think that that's indication that you're having a boy because the baby's like growing, measuring big? And it could be, it could be, or like I told my mama, it could just be a little fatty girl, who knows? But I feel the same as I did with the other 2 pregnancies. Most of my symptoms are pretty consistent with all 3 pregnancies. Cravings have been exactly the same. Even my size has been the same. So even though this baby is measuring big, I still was comparing myself to some of the pictures that I took when I was pregnant with Kennedy and with Cameron, and I'm still measuring the same, or at least I look the same physically. But I will say, remember, they changed my date a few times. So let's say I was going by my last menstrual period and I was comparing my pictures of what I look like now at 28 weeks, which I thought I was 25 weeks or 25 and a half, then okay, yeah, I'm slightly bigger than I was with them. But because they're saying I'm measuring at the 28-week mark, then I'm just doing everything based on that time frame. And if we consider it apples to apples, then I look the same. So I don't know. Who knows? We will see in July, maybe end of June. We don't know, whenever this baby comes. But yeah, I'll know then whether it's a boy or girl. And again, during my visit with my maternal fetal medicine doctor, he's very cognizant of me not knowing the gender and not wanting to know the gender. So he always makes a point in the beginning of the conversation to say, okay, you still don't know, you still don't want to know. And I'm like, correct. So he tells me to close my eyes anytime he's moving the monitor over the baby's genitals. And so I love that because I just don't want any slip ups. I don't want, we've gone this long. I would hate to go this long, 7 months, and find out just because of a slight mistake. And so he's been great at that. So shout out to my MFM doctor. So here is my 28-week belly. Check me out. You can see it. I'm starting to actually show like through my clothes and my shirts. Oftentimes I go into a place and nobody can tell I'm pregnant, and so I have to tell them. Like this week I had to go get a TB shot. Oh, I wanted to mention that to you guys. I had to go get a TB shot for work, so unrelated to pregnancy, surprisingly. And so I ended up just going to a local Concentra, and I had to get a drug screen, and then I had to get a TB test. And annually I get a TB test because I work in the medical field. I work in hospital settings, and so it's required by all the hospitals that I go to. While I was sitting there, I was like, am I supposed to not have the TB test when I'm pregnant. And it's something just hit me. Like, I know it was God because I didn't think about it beforehand. Nobody said anything. At this point, they didn't know I was pregnant. So it's not like they would know to mention anything about that. And so I actually went back to the counter and I said, I'm pregnant and I want to know if it's okay for me to get this TB test. I know it's just a skin test, but I know you guys put the disease in my skin and then I have to come back in a couple days to see how my body reacts to it. Am I supposed to avoid this when I'm pregnant? And he said that he immediately, the guy, the tech that worked there, he was like, it depends on who you ask. And I was like, well, what is that supposed to mean? And he said, well, some medical professionals say, no, absolutely not. Do not get this when you're pregnant. You want to reduce all risk for everything as much as you can. And there's no point of putting a disease in your body when you're pregnant and you don't necessarily have to. And other doctors say, well, it's okay. If it's later in the pregnancy, it's okay. Based on some other factors, it's okay. I said, well, I am not taking that word for it. Like, I need to go holler at my doctor. So I said, let me make a quick phone call and let me call my OB and get her opinion on it. And I called my office and my doctor got on the phone and said, do not get it. And I was like, oh my God, thank God I called you. She's like, Toni, they have blood tests to test for TB. Now, I didn't know because every year I get the TB test, I do the skin. I've been doing that for a decade. And so she said, when you're pregnant, you need to get the blood test. They're probably going to tell you it's going to cost you more, but that's your peace of mind. Like, that's your safety we're talking about. That's your health. That's your baby's health. So she's like, get the blood test. I highly recommend the blood test. Do not get the skin test. And I said, well, okay, whatever you say. Now, the skin test was probably 50 or $60, and the blood one is $200. It's a little over $200. So it's a lot more expensive. But again, like my doctor said, it's worth it. Just wanted to mention that in case any of you have to do that for work or for any reason, weren't sure if the TB test, it's not contraindicated in pregnancy at all, the skin test, but you should get the TB spot test, which is the blood draw, instead of the skin prick, just to be on the safe side. The reason I even brought it up, I was just sharing that when I got there, they didn't know I was pregnant. And when I came back with the lab tech, he told me, which was so funny. This is a sidebar conversation, but when he brought me back, he's like, okay, we need to figure out what we're going to do because she's going to switch tests. And so we need to refund her for the skin TB test. And she's going to come back for the blood test because she's, and then he looked at me. I was like, it's 2021, dude. Like, you can't say she's pregnant. Like, so I don't know. I don't know if y'all ever experienced weird things like that when it comes to men and circumstances like that, where maybe it's a stranger or maybe it's not, maybe it's somebody in your circle who just doesn't feel comfortable saying that you're pregnant or telling someone that you're pregnant, even though you explicitly just told them you're pregnant. I don't know if he didn't believe me because I don't show very much, or if he just was very uncomfortable just having that discussion about someone's pregnancy at all. Like, he works in the health field, like he deals with a lot of things, but pregnancy shouldn't be, I don't know. Maybe it's just me, but I've had these experiences with my last two as well. It's when someone, you tell a male that you're pregnant, you tell a woman you're pregnant, and it's a whole different reaction. She's usually excited for you, and she wants to tell you about her kids if she's got kids, or if she doesn't have kids and she's an auntie, she wants to tell you about her nieces and nephews, or how far along are you? When I was pregnant, I had this, or I did that, or my experience was this. So it's obviously it's a woman's world, but it was just so interesting having different reactions with men with all three pregnancies when you tell them you're pregnant. Like, they immediately look for your ring. Like, a woman don't look for the ring, you know what I mean? Like, it's just funny. I don't know, just this taboo thing with men in pregnancy with other women. So that's it for this week. Hope y'all enjoy my little rambling on. I hope y'all feel me on a lot of these topics that I'm sharing. If you do, then I'd love for you to subscribe today and like and comment any material that you are interested in hearing maybe more about, or if you have questions about anything, or you just want to share your experiences, I would love to hear them. So go ahead and comment on any of the videos, like them, and don't forget to subscribe. I look forward to seeing you next week.